Assalamualaikum. My name is Nurul Hafini binti Muhammad Fauzi from RAS 2224A. Today, I want to talk about the role of manganese 2 complex in treat tumor or cancer. First of all, I will introduce the cancer. Cancer is a group of diseases that involve an abnormal growth of cells that may attack or spread to another part of the body. For example, is carcinoma, carcinoma, melanoma, lymphoma, and leukemia. They form a subset of neoplasms that have experienced unchecked development, frequently forming a mass or lump, but can be diffuse. 90% until 95% cases because of genetic mutation, while 5 until 10% cases because of inherited genetics. Symptom of sign of the cancer is abnormal bleeding, prolonged cough, lump, loss of weight without know the factor. And the ways to prevent the cancer is not smoking, not drinking alcohol, maintaining a healthy lifestyle, and take enough vitamins. Next, I will introduce about manganese. Manganese is a chemical element with the symbol Mn and atomic number is 25. Manganese is a mineral present in a number of foods including nuts, legumes, beans, tea, whole grain, and leafy greens. It is considered as essential nutrient because it requires proper functioning by the body. People are using manganese as medical products. The objective of this report is to observe the effectiveness of metal ions such as manganese 2 complex as a cancer therapy. The opinion of this issue is metal ions are required for a number of critical functions in human life and living organisms and are becoming ever more important in the study and treatment of a variety of human diseases as diagnostic and treatment tools. If have the symptom of cancer, must undergo medical checkup in hospital and tell all the symptoms to doctor, so the doctor can give immediately of good treatment. The way to prepare manganese 2 complex is by adding the ethanol solution in manganese 2 chloride tetrahydride to the light ligand ethanol solution. The solution was stirred at room temperature for 6 hours and collect the dark green precipitate. Next, wash the precipitate with a mixture of water and ethanol and recrystallize with ethanol and put in a 50°C oven to dry. Manganese 2 complex has been known as an agent for interacting with mitochondria and oxygen metabolite function in cancer cells affected by complex structure and conformation. Manganese 2 complex of N substitute with dipyrimidal methylamine could be improved as multifunctional anti-cancer complex to interfere with the absorption of calcium 2 in mitochondria and the metabolite of oxygen by signaling induced apoptosis of cancer cells through hydrogen peroxide. There are some advantages and disadvantages when used manganese 2 complex in treat cancer. The advantage is it is a nature component that cells have chosen. They are mostly located in the catalytic enzyme domain and include multiple biological processes from electron exchange to catalysis and structural function. They are always used in cellular activities. The disadvantage is metal complex will decreasing in their stability when the temperature of reaction is increased. It needs other usable carrier with chemical thermal and mechanical stability. Another metal complex that have same function and can treat cancer and tumor risk is cis-diamine dichloroplatinum 2 or known as cisplatin, which is one of variety of metal complex in therapy of cancer. In conclusion, there are many types of cisplatin that have been produced such as carboplatin, platin, and lobalplatin. These compounds exhibit ambivalent structure where some are correlated with cancer induction and development. Some have shown effectiveness in cancer treatment and some exhibit both properties. Despite the difficulties resulting from the clinical use of manganese compound, the market for metal-based compound in cancer therapy is growing. Increasing of cancer treatment studies using metal complexes may be due to the increased risk of cancer or the degree of in vitro cytotoxic effect that metal-based compound that demonstrate, particularly those that have recently been synthesized. That's all from me. Thank you.